Today is April 19th, 2020, and you're tuned in to the Too Fast podcast, where the future farmers and agricultural specialists are serving you the weekly scoop on the world. I'm your host, Kandeaux the Farm Plug, and today we have with us Elise Tolbert. This podcast is brought to you by Tuskegee University's College of Agriculture, Environment, and Nutrition Sciences, Tuskegee University Cooperative Extension Program, and Anchor FM. We're currently available on many platforms, including Apple Podcasts, Breaker Audio, Google Podcasts, Pocket Casts, Spotify, and Radio Public. And here we are today with our Sunday edition of the Weekly Scoop. The White House and congressional leaders could be nearing an agreement on a new wave of coronavirus relief funding. Negotiations have been ongoing to replenish popular programs created as a part of a $2 trillion response package passed last month. Treasury Secretary Steven Mnuchin told CNN that he's hopeful that a deal could be reached as early as Sunday, or Monday or Tuesday, to replenish a tapped-out small business loan program, and that the deal would also include additional funding for hospitals and testing. The Senate could approve the measure as early as Monday and the House on Tuesday. Who is COVID killing? The Center for Disease Control and Prevention, the CDC, has started publishing racial and ethnic data from COVID-19 cases on its website after calls from Congress to provide a more comprehensive picture of how minority communities are affected disproportionately by the outbreak. In Michigan, for example, the state with the third highest death toll in the country, behind New York and New Jersey, the data from Michigan has already shown that over 40% of people who have died from COVID-19 are Black. Yet Black people only make up 14% of the state's population. Can COVID-19 bring temporary world peace? There have been talks of a world ceasefire amongst the 15-member United Nations Security Council, which is tasked with managing matters of international peace and security. They last met on April 9th to discuss the pandemic. The council consists of 5 permanent members: China, France, the Russian Federation, the United Kingdom, and the United States, and 10 non-permanent members that are elected for 2-year terms by the General Assembly. COVID-19, which first emerged in Wuhan, China last December, and has now been reported in more than 180 countries. The ceasefire news comes amid ongoing tension between Trump and the United Nations, exacerbated by the president's claim on Tuesday that he would halt U.S. funding to the World Health Organization, depending on whether or not he has that authority. And now it's time for an interview with Elise Tolbert. Elise Tolbert, an environmental health scientist and public health practitioner who currently works as the Partner Engagement Program Manager at the Climate Action Campaign. In her role, she leads highly visible, highly effective campaigns and activities that engage Black American, faith, environmental justice, and youth-based organizations to demand action and legislation on the global climate crisis. At an early age, she developed a deep passion for the natural environment, which later molded her career interest in the environmental field. Elise received her bachelor's in environmental science from Tuskegee University and her master's of public health and environmental health sciences from the University of Michigan. Ms. Tolbert's interests in public health lie at the intersection of climate change, environmental health policy, and environmental and social justice. She has employed her interests working as a program manager at Tuskegee University's Water Quality Outreach and Testing Program and as an environmental health fellow at the United States Environmental Protection Agency. Elise is also the founder and CEO of Next Step Up, a nonprofit organization that empowers high school students to pursue their dreams by providing mentoring and tutoring. Ms. Tolbert lives by the motto, blaze your own trail, which reminds her of her responsibility to follow her heart and create a path for others. What is that relationship between COVID-19 and climate change?
Climate change has not caused COVID. Climate change has not caused the spread of the coronavirus around the U.S. and around the world. But the similarity in climate change and COVID is in the response to both climate change and in the response to COVID. What we've seen with climate change is that this administration particularly has denied the science on climate change and denied the science on COVID. We've known about the COVID spread since about November, December. And even though we knew about it, we saw it in China, we saw it spread throughout Italy, we did little to nothing to prepare for the spread of the COVID virus crisis. Right. Similarly, we've known about climate change for over 50, 60, 70 years, and yet we still find ourselves dealing with disasters such as Hurricane Sandy, such as tornadoes in the Midwest, such as crazy wildfires in California. And that's because even though we've known about climate change and known about COVID for so long, we haven't addressed and fully acknowledged the science. And that has been one similarity between COVID and climate change that has been really detrimental. I would say that the second thing that's similar between COVID and climate is the lack of a cohesive strategy to address both. So right now, what we see in so many states is that state governors are basically developing a crazy patchwork of plans to slow the spread of the COVID-19 crisis. And these range from stay-at-home orders to closing down certain businesses and industries to no action at all. So we don't have a national strategy to address COVID. In addressing climate change, a few years ago under the Obama administration, the world had finally reached a pivotal point by adopting the Paris Climate Accord, which was really great because for the first time, we had a global plan to address climate emissions, mitigation, and adaptation. However, this administration pulled out of that agreement. So once again, states and cities are left to address what is a global problem, but on their own using a patchwork strategy. So I'd say that's the second thing. And the third thing that's similar between COVID and climate is who it impacts. Specifically, who it impacts most disproportionately. Black people, low-income communities, which are not the same, but, Black communities, communities of color, low-income communities, really around the world, but specifically...
Or maybe, how about lower resource communities?
Lower resource, yes. Yeah. Communities have been ringing the alarm for so long that we have been disproportionately impacted by climate change. You can look at Louisiana and see the sunny day flooding in communities there. You can look at North Carolina, South Carolina, and see that the hurricanes are hitting the Black and brown communities even harder. And you can look at communities all across the nation and see that they are being hit harder by extreme heat and all of the impacts of climate change. And unfortunately, that holds true with COVID. COVID is also impacting Black communities specifically harder. We see in Chicago, in Milwaukee, in Alabama, over 70% of the deaths are African American deaths. So those are some of the similarities between COVID and climate change. And they're not natural. It's not that climate change wants to hit us harder or that COVID wants to hit us harder, but these are man-made, created similarities because of the response to both of these crises.
So when we talk about climate change, right, it's multiple things that contribute to the global greenhouse gas situation, and all of the things contribute into that. But like deforestation and intrusion on nature. I understand that the COVID-19 is from, some form of human wildlife conflict, in the way that it's a zoonotic disease. So the disease actually jumps from animals to humans. So how does climate change play a role in all of that as well?
Well, why are we somehow having this new or increased interaction with nature? And I would say it's because of the research says it's because of a number of reasons. The first is rising land temperatures. Land temperatures are rising because as the climate continues to change, we see an increase in temperature. And with rising land temperatures, it changes the geographic landscape of where some of these vectors can live. So, for instance, we usually see mosquitoes in very warm subtropical climates. But because of rising land temperatures, mosquitoes, which could carry illnesses like West Nile virus, can now breed for a longer season and can now live further than they could ever live before, which means that we can interact with them for longer periods and in more places than we've ever interacted with them before. The other reason is because of ocean temperature rising and sea level rising. The sea level is rising because of climate change. Because it's getting warmer, more of the ice in Antarctic is melting. And as sea level rises, it changes water distribution, which means that we have a higher likelihood of contacting waterborne illnesses. So that's another thing. And then, there are a lot of human-made reasons why we see the emergence of human pathogens. Some of those include travel, trade, and tourism. If we lived in a world where everyone was on horse and buggy, it's highly likely that the coronavirus wouldn't have been able to jump from China to Europe to Africa to the United States as easily. But because we live in a very global world in which we're able to tour to more places and more exotic places, travel to more places, and trade goods and services more places, we're able to just move pathogens around as we're moving ourselves around. And
Wow. So
yeah, I'd say the last reason is pathogen adaptation. Over time, as the temperatures get warmer, pathogens are just able to adapt and they're able to live longer, which is why we're seeing, again, things like West Nile virus and Lyme disease and other pathogens living longer and adapting to be more sophisticated.
I was just going to say that it really brings to mind migration, right? A lot of times we think about the socio-political ramifications of human migration and immigration and how people move around, but understanding what that means for the wildlife, and as we start to come more in contact and as their migratory patterns change, what does that mean for our patterns as humans? And so, with these encounters becoming more and more probable and more likely to occur, how does preparedness become more important for not only the human race, but for Black and brown communities specifically?
That's a great question. Preparedness is key. They say the one enemy who defeats you is the enemy you never prepared to beat. And that is definitely true of climate change. That's definitely true of COVID. For instance, with COVID, we could have been monitoring and surveilling the spread of a number of different viruses before the COVID-19 crisis hit the United States as well as significantly as it did. But because this administration got rid of the office that would generally do the surveillance of pandemics, the Office of Pandemics, we didn't have anyone to develop a strategy so that the United States would be prepared to deal with an issue like this. For climate change, and specifically for Black and Brown communities, preparedness is a matter of life and death. I'd say, for instance, when it comes to extreme heat, we know that our summers are getting warmer and warmer and warmer, particularly in the Southeast. And in the Southeast United States, we have the highest number and concentration of African Americans in the United States. We also have the states with the highest level of poverty, unfortunately, in the Southeast. And so that means that, and we also know that we have some of the highest temperatures in the Southeast, which means that when summer comes, some people's grandmothers and aunts and uncles have to make the decision between paying a AC bill or paying a light bill or putting food on their table. And that's not a good decision to have to make. So we need our governments to ensure that people are able to afford energy efficiency or for ways to keep themselves cool during the summer, and developing those types of programs to help our communities adapt is what will continue to keep them safe and afloat during climate related extreme weather events, things of that sort going forward.
With all that being said, and there are so many other directions that we can go to, right? We didn't even touch on like the healthcare system and how all those things contribute to a lack of preparedness for us as a country, and specifically the Black community. But what would you recommend to a Black or Indigenous community to decrease the spread of COVID-19 and decrease climate change in their community?
Well, here's a few things. A study came out recently that was really big. The study came out of Harvard that showed that the communities that have been historically more polluted, that have had more air pollution, are also some of the communities where we see some of the highest death rates from COVID. And that's really big because this is one of the first studies that can link air pollution to a virus and to deaths from a virus. We know that African Americans and African American children have some of the highest rates of asthma. And we also know that African American communities are more likely to live near a coal-fired power plant or some industrial polluting facility. So if we see that the highest number of deaths are in places that are in close proximity to these polluting facilities, and we know that we are more likely to live next to a polluting facility, then we know that puts a lot more African Americans at vulnerability for death from COVID. So what I say to a Black and Indigenous leadership of a town or a city or anything is that the first thing is that we need the Environmental Protection Agency to really right now enforce surveillance of these polluting facilities, hold these polluting facilities accountable, because this is a respiratory illness and it's not safe or healthy to breathe in even higher levels of pollution during the midst of a respiratory crisis. The second thing I say is that we need to slow the spread by ensuring that we have strict and very clear guidelines in place on where people can go and what people can do, that we need to protect our workers because we know that a lot of our workers are on the front lines who still work at the grocery stores and places of that sort. Protect our workers, and that we should ensure that we're checking on different segments of our population. The second thing I say is that we need to make sure that we're getting the message out in a way that resonates with people. So I know for myself, for instance, both of my great grandfathers were a part of the Tuskegee syphilis study. And so in my family, there's a legacy of medical mistrust of the government and of mistrust of the healthcare system. And, we can't just forget that mistrust exists in the midst of a medical crisis. If the medical systems and the government are going to be the central point for addressing this crisis, then the messaging they put out needs to be unique and come from very valid sources that can resonate with our communities. And the process has to be a process that we can trust. The vaccines, if a vaccine comes out, has to be a plan that we can trust. And last, I'd say that communities should leverage their best resources to make sure that people are protected from all angles, economically, their mental, emotional health, which is associated with, a changing climate too, is all protected in the midst of this crisis.
Wow. And I read somewhere a couple of people have been making comments that, and it's interesting you mentioned mental health, is that the mental health fallout from COVID-19, we have so much isolation and people may not have that proper support or have, proper coping mechanisms, stress coping mechanisms in place to be able to deal with some of the emotions they may feel while they're in practicing social distancing. So we have so many things that we kind of have to get in order. And so with our final question, and this is really one of my favorite parts, is what advice would you have for future farmers and agricultural specialists?
My advice for future farmers and agricultural specialists are that we see that we are in a world that is rapidly changing, rapidly evolving, with challenges that are critical for defining what human life looks like. And future farmers play a very critical role. I think that we need farmers who understand agriculture, but farmers who also understand people and the ways in which we live. I saw a farmer on TV saying that their produce wasn't going out to restaurants and stores anymore. And this farmer was literally running over a field of tomatoes because he said, well, it doesn't matter, I'm not going to sell it. That's a farmer who knows how to produce food, but not how to meet the needs of the people. Booker T. Washington always talked about training the head, the heart, and the hand. I think that if that farmer understood the needs of the people, he would realize that if he's going to throw this away anyway, that there are millions of hungry people who would appreciate fresh produce right now. And so I think that my best advice would be that future farmers can see this as an opportunity to develop unique strategies to meet the needs of all people, but specifically to understand how to develop systems and businesses that serve the needs of communities of color.